So anyway, I was talking about putting VAT on dentistry, and it just occurred to me that it might be a little bit more difficult than they think to do that. I mean, speed shouldn't be a problem. They put VAT on private school fees fast enough, um, but that was a complete sector. I mean, I suppose they could put VAT on dental fees, but they would then they'd have to specify that and justify why they haven't put it on private chiropody, for example, or private optical services, or any other sort of private medicine. And because they're doing it for the wrong reasons, they're doing it for this sort of collectivist attempt to try and do price manipulation. In effect, what they're doing is they're trying to make this private treatment more expensive, to decrease the size of the private market, because broadly speaking, supply and demand. The more you increase the cost of the supply, the less the demand. Although that does tend to sort itself out. I think all they do is they'd end up upsetting a load of people that go to private dentists. And let's face it, I think more people go to private dentists than put their kids through private school. So they would have a little bit more of a problem with dentistry, perhaps. And not only that, it's not as though they can argue that there's a perfectly good public health system that that the public could avail themselves of if they wanted to. I mean, they might raise a bit of revenue. What they'd have to do is they'd have to then say that dentists could claim back all their input VAT costs. So all the costs that were passed on to the public through fees, most of which would then be recoupable, because you'd only be charging the VAT on the dentistry. All the rest of your input costs you could then claim back. Whereas at the moment, the government's getting the VAT on all the input costs. It's getting put onto dental fees. So I don't have to think about that, but I can't actually see the fees changing that much, because every 3 months you'd get a massive great, you'd have to send a check off to the Inland Revenue, but it wouldn't be as big as they think, because alongside it, there will be a massive great claim for everything we bought. So, and as I say, I think because it is now, I mean, private dentistry is a monopoly market. The government can't provide private dentistry and has no hope of doing it. It's all they're going to do is have a bunch of patients who can't find an NHS dentist in their area being told that their private fees are going to go up 20%. So that's not really going to help them, is it? That's going to cause a lot of stress in various sundry MPs' constituencies. But that's the only thing I can see. I don't see why the CMA should recommend that they put VAT on private dentistry. I don't see how that's going to make the market work any better. Like I say, the market is pretty well working. It's working pretty well anyway. It depends whether you define market working well as in the free market, or working well as in a sort of command and control type economy, where the market's doing what the government wants it to do and thinks it should do. I think at the end of the day, the government just wants more people to be able to have access to dentistry and what they call affordable. But they've gone right past the point at which even NHS dentistry is described as affordable. I mean, someone who wants a denture on the NHS, is paying, I don't know what they pay now, 300 quid or something. But it's very difficult to compare NHS and private, because with NHS, the fee covers a variety of things. Whereas, like, for example, you pay £300 for a denture, but within that £300, you also get all your fillings done. You get all your root treatments done. You get all your teeth taken out. You get your teeth scaled and polished. You have a checkup. You have X-rays, orthodontic assessment, gum assessment. You name it. Now, whether you actually get all those things is another matter entirely. But that's why you can't say, well, can you compare a private denture to an NHS denture? All you can do is compare a course of treatment, say, what someone would need on the NHS, which would come under the highest applicable band, which for non-dentures and non-crowns and bridges would be band B, or and then price that up in the private sector, and then in the private sector, as I say, it's going to come out easily 3 times as much. Easily, you can have 5 fillings in the NHS for the less than the cost of 1 filling privately. And I should know, I spend all day taking them out for you. So anyway, I won't keep going because I only wanted to say something about the VAT. I just don't. It just occurred to me that is going to be quite a difficult thing for them. Now, just because something's difficult or because it's stupid doesn't mean that they won't do it. Right? If there's one thing we've learned about government, it's that they do not balk at doing anything just because it's stupid and wrong, time-consuming and expensive, and ideologically inconsistent with everything that they've then done up to that point. I just found out that Jason Wong, the chief dental officer, follows me on X. God knows why. I don't post anything on X. I haven't posted anything on X for about 5 years, so I don't know why he's following me on X. But I dare say I've got my 500th episode coming up soon. But part of me says I'd love to go up to London and in the same day interview Eddie Crouch and interview Jason Wong, and make that the 500th episode. But it's not for 17 for 35 viewers. Really, you must be mad. You must be mad if you think I'm going to invest that amount of time and money. I know it'd be fascinating. I know it'd be interesting. I know that they would probably say no, so it wouldn't really matter. But there isn't that level of discourse within the profession. The old days of Arthur Eisenstadt and Helen Hay, and when the annual conference of local dental committees used to be some sort of meaningful policy forum, are long gone. They're long gone. Helen Hay died of ovarian cancer. Very sad. I mean, a lovely woman, bit sort of, bit like Hyacinth Bucket in a way, but very well meaning and like also intelligent as well. Came across as a bit of a sort of I don't know, garrulous grandma, but in fact was very was sharp as a knife, and it was a great shame when they set up Women in Dentistry. I think because they were opportunist, the women were on the GDPA council, and but they just wanted to set up Women in Dentistry. It was just, as I say, it was pointless, and it never really went anywhere. And I don't know whether they expected to be admitted to meetings because they were women or whatever. But they certainly had their own agenda. But to a certain extent, it duplicated everything that we were trying to do. It just split the opposition in a way. And it isn't anything that couldn't have been done with a bit more effort through our council. If only they'd not just sat there and sort of listened to us talking. We were very meritocratic, the GDPA. We couldn't, in fact, we were about as meritocratic as a bunch of dogs fighting to get to the top. That's what it was like. And okay, perhaps women can't do that as well. But certainly we had, I'm sure we had women presidents. Anyway, that's long ago and oh so far away, as Richard and Karen Carpenter said. And because you don't know who Richard and Karen Carpenter are, I am going to call it a day. All right, wish me luck getting to work through this fog. I'll talk to you soon. Bye.